Hello. Today we're addressing the ongoing government shutdown, in which enhanced ACA subsidies have taken center stage. At the center of the debate is whether to continue subsidies to individuals who purchase health insurance on the federal exchange. The ACA subsidies, which help drive a massive surge in health insurance enrollment, are set to expire. If Congress does not act, we are looking at two major market consequences for the healthcare system. First, analysts predict that premiums will rise by 50% to 75% for millions of Americans, which could push up to 4 million people out of the insurance market. Second, this will lead to a significant spike in uncompensated care for providers and a sharp increase in cost sensitivity from both payers and patients. For the health technology sector, this means the addressable market would shrink, and every dollar spent on a tech solution could face more scrutiny. The risk is high for companies whose business models depend heavily on the ACA population. There are three potential strategies to protect your company by pivoting away from a reliance on federal support. The first is pivot to stable payer channels. Reduce exposure to the ACA exchange market. Instead, if possible, intensify focus on stable areas like Medicare Advantage, Medicaid, and large self-insured employers, or even direct-to-consumer subscription models. Second, emphasize the ROI of your product or service. Your offering can no longer be a nice-to-have for patient experience. It should be a must-have for financial stability. Consider moving beyond testimonials and focus on hard data. Prove a clear, measured reduction in high-cost events like dollars saved per patient by preventing hospital readmissions or ER visits. Third, consider locking in clear reimbursement pathways. Where applicable, pursue formal regulatory clarity such as FDA clearance for prescription digital therapeutics. Why? Because FDA-approved products have clearer, non-politically volatile HCPCS billing codes established by CMS. Securing these codes creates a direct, defensible reimbursement path, regardless of what happens with broader ACA subsidies. The takeaway is clear. Health technology companies can prepare by considering steps such as diversifying their market, proving a definitive financial return, or proactively securing reimbursement pathways that are insulated from political swings. This is a fast-moving situation. Whether subsidies are restored or not, the debate underscores how closely health technology innovation is tied to federal policy, and staying agile will be key. And that concludes our Free Flow update. Thank you for joining us today. For more information, please visit our website at orensteinlegal.com and navigate to the podcast page. Remember to subscribe or follow Free Flow on Spotify, Apple Podcasts, and YouTube so you never miss an episode or update. This podcast is for informational purposes only, is not legal advice, and does not create an attorney-client relationship. Thank you for listening.